Welcome to your 4state.com's Medical Corner. I'm Sajata Khandelwal. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thanks for having me.
Our first question for you, what are mycotic nails?
Well, mycotic nails are an infection of fungus in the toenail plate. So your toenails can become infected with fungus, and they can get thick and yellow and brittle. And this happens quite a lot to most Americans. It's really an epidemic almost in America at this point in time, with sometimes up to 40% of the adult population being infected. These brittle nails can catch on socks, which can cause the nail to pull off, and that can cause trauma to the nail bed and different disfigurements. Also, they're not sightly. People don't like to look at them, and they try to hide them, and they're ashamed of them. So it's an emotional problem sometimes for people to have these deformed nails on their toenails as well.
How are they treated?
There are a lot of ways to treat toenail fungus or mycotic nails, and sometimes insurance plans cover these treatments and sometimes they don't. Our treatments are about 90% effective in clearing the nail plate of the fungus, and there's a 4-step approach to what we do. First, there is a medication called Formula 3, and it's a nail polish, and you put it on in the morning. And then there's another medication called Gortochrome, and it's a nail polish as well, and you put that on in the evening, so that's twice a day. There's also a shoehorn with a UV lamp on it, and that goes inside your shoe and sterilizes your shoe. And some people advertise these shoe sprays that kill everything in your shoe, but the problem is there's bad chemicals in those, and the chemicals dry, and then you put your shoe back on in the morning, and then your foot sweats, and the chemicals get into your skin, so you could have a reaction to that. So that's not really the best way to go. The UV shoe lamp sterilizes it without chemicals, and it's 99.9% effective. So the final thing is a laser. Now, these lasers have come a long way, and there's only a few that are FDA cleared for nail fungus, so I recommend using the laser because it's safe and effective. Using all 4 of these is 90% effective. Sometimes insurance covers removal of the nail plate permanently, so you don't have a toenail, and some people don't like that. And they also cover oral medications that can have side effects, and I've personally had patients that have used these, and they've lost their sense of taste temporarily, and they've had elevated liver enzymes. And the literature does state that several dozen people have died from these medications, but insurance companies will provide coverage for that, even though that is only 30% effective, whereas our protocol is 90% effective. So again, the 4 things are Formula 3 in the morning, Gortochrome in the evening, the Steri-Shoe, and the laser. And that clears 90% of the infection in most patients.
Thank you so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on your 4state.com.